Doctors of Reddit, what is the weirdest thing a patient wouldn't admit? Not a doctor, but this happened to my friend. My friend was in a really awful car accident. She was hit head on by a huge pickup truck that was going 83 miles per hour in a 40 mile per hour zone. The driver had passed out at the wheel. When police arrived at the scene, my friend had a punctured lung and several broken ribs. The other driver was unscathed and still passed out at the wheel. The police found open alcohol containers, marijuana, and other illegal substances in his vehicle. He didn't wake up until the ambulance had already arrived at the hospital and he was inside. The doctors, who had been informed that he was under the influence, asked him if he remembered anything. He told them, "I have low blood sugar. I must have passed out." And then they did a drug test and found he had been using everything they found in his car. Real late here, but I am a nurse and we just had a patient, mid-50s male, strictly pooped in diapers. When asked why, he said so he can freeze them. Ends up he has a deep freezer in the garage full of poopy diapers. He also works for housekeeping in the hospital. A few years ago I had one kid, maybe 16 or 17, who evidently had heard of a challenge where you can fully insert a light bulb into your mouth. But when you try to pull it out, you can't open your jaw wide enough and the bulb shatters inside. Well, after about 3 hours of picking glass from out of his mouth, in every spot imaginable, gums, under the tongue, roof of the mouth, throat, etc., I asked what went down and he just would not admit that he put the light bulb in his mouth. His main story was that his friend must have slipped it in his mouth when he was sleeping and punched him in the jaw. However, upon talking to this friend in another room, he confessed that the boy had tried to beat the challenge. His friend even showed me videos of other people trying it. So I go back in with the patient and bring his guardians in this case an aunt and uncle, and explained the whole light bulb challenge without giving his friend up. When asked what I was talking about, I explained and said there are many videos on the internet about the exact thing I'm talking about. They also revealed that he had tried several dangerous stunts and challenges before, but even still the stubborn bastard wouldn't admit a thing. He was adamant that he had absolutely no part in his injury and that everyone was out to get him. It's just crazy to me how arrogant and thick-headed some people will get. They'll do anything before admitting to doing something that's stupid and short-sighted. Not the doctor, but patient. Doctor asked me during a physical when my last test for gonorrhea and chlamydia was, and never asked whether I've been sexually active. I'm a virgin. My doctor was cute, and for some reason I felt embarrassed to admit I haven't had sex, so just rolled with the recommended urine test. $250 plus and the expected negative results later. I felt really stupid. Looking back, pretty weird thing to not just admit. My doctor couldn't care less what my sex life was like. Would have saved me some money. Yikes. So in my story, I am actually the patient not telling the doctor something, but I felt like it was good edort and relevant enough to share. But when I was like 13 or so, I ended up with a urinary tract infection, which was odd because I am a guy. I ended up having to go to the children's hospital and had to go through all this stuff to try and look at it and fix it and whatever doctors do for a UT. What I didn't tell them, and still haven't told anyone except my wife, was that this happened because I was curious what it would feel like to shoot water up my dong with a hotel shampoo bottle. Not great, but if you pump air up there it makes a mini fart sound when it comes out, so I guess that's a plus. Hey man, 13-year-old me used the pressure washer setting on a shower head to shoot water up my penis. It would cause the most intense orgasms I have had to date and would last as long as I held it there, so often several minutes. Blood in my urine was a bit of a turn off though. Usually don't mention it because I am afraid some dummy will try it, but I will assume you have the sense not to. Not a doctor, yet, but was volunteering in the emerg ward and a woman came in with her pregnant daughter. Not only did she refuse to believe her daughter was pregnant, but was feeding her laxatives to deal with the extra weight. It was pretty horrible stuff. I'm vet student. Many clients like to say I don't overfeed my dog cat. That's just their normal size when their pet looks like a watermelon. I had a patient who came with his boyfriend. He had severe abdominal pain. He claimed it started when he had a difficult poo. Tests showed he'd ruptured his colon and it turned out it had happened using toys during sex. To me it's weird because he'd introduced me to his boyfriend, so it's not like he needed to hide his sexuality. pretty sure it's more likely hiding the size of his bad dragon. I'm a doctor of dental medicine. You all freaking lie to me about flossing. One guy who swore he didn't know why he was losing his teeth because he was brushing twice a day caused me to get heated. I have him a mirror, scrapped a chunk of plaque off his teeth from his gum line and showed him a big heaping pile of plaque proving that he was not brushing. I gave him the benefit of the doubt and told him I would show him how to brush, and he turned it down because that couldn't possibly be it. Some people just want dentures as fast as possible. Kind of the opposite situation, but I had to go to the ER because I couldn't keep anything down and I was dehydrated. Doctor asks if it's possible that I'm pregnant and I said I am sexually active, but I just finished my period, so it was unlikely. She just stared at me for a second and starting laughing. Apparently no one ever just admits they have sex and always tried to hide it, for some reason. Turns out I had a kidney infection anyways, lol. I went into the ER because I was 8 weeks pregnant and bleeding with lots of pain. Was worried about an ectopic. Got asked what my chief complaint was. Described the above. Then got asked if I was sexually active recently in the same conversation as they were filling out their info. I was so confused, as if they didn't just hear me worrying about ectopic pregnancy. Starting residency this week. I posted a while back but will post it here again. It wasn't super obvious at first, but after looking into her records it became clear. So this happened on my psychiatry rotation in medical school. Not currently in a psychiatry residency though. There was a patient at an inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously, so the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. Maybe she just knew your Reddit username. FNP here. Had a first job out of school doing Medicaid risk assessment for insurance companies. I basically had to do complete family social extensive reviews and complete pay and head to toe and make any new preliminary DX and referrals for the insurance company in 60 minutes. Very taxing, but it definitely helped me hone down my skills in getting information from I have this one patient, and doing my thing getting their family history, etc, and get to drugs and alcohol use. Normally pretty good disclosure about obvious things, especially if they are being treated for things like alcoholism etc. I get to smoking history and expect to hear 20 ppd for 15 years given the smell in the house and the opened blunt on the table that was pretty clearly going to be rolled before I arrived. Deadass woman with a 10-month-old on her lap looks me in the eye and says no to any and all smoking history. I stop and look at her in the eye and say, are you absolutely sure? What's this? Points to cigar blunt opened. Yay, that's not mine. You live with a SO at all or roommates? Number. Oh okay. I had gone over myself imposed time limit on that charting section, so I just wrote down no in the chart and had her DX and referred for tobacco and drug abuse. I wasn't about to argue with a woman who couldn't admit an issue so clearly right in both our faces. Radiologist here. I've seen lots of weird things, but the weirdest someone wouldn't admit was the trauma patient. Female, who got pan scanned because she was altered. I saw a cube of gas and debris in her vagina which did not look like a tampon normally would. After some thinking, I figured it was either some drugs she was trying to hide or potentially some weird foreign body. I advised the trauma team to investigate. They were not comfortable, so they consulted the jinns. They sent a first-year resident who asked the patient if she had anything in her vagina. The patient denied anything. The jinns reported back to trauma, who reported back to me that she denied anything there. I advised a direct visual examination, which occurred finally an hour later, at which time they found nothing. To this day I have no doubt she had a leprechaun in there. TLDR, don't send a first-year resident to do uncomfortable things without explicit instructions. That they had maggots in their foot wound. Patient with diabetes came in to see me in clinic. Said foot had a wound. I asked when they last looked at it. They said that morning, and this was an 11 AM appointment. Helped them take off their sock. There were 4 maggots busily cleaning a pretty large ulcer on the side of the foot. I threw up a little in my mouth and proceeded to remove the maggots and dress the wound. A dang clean wound due to those maggots. Larvae therapy is really effective. We use it in the hospital. Med student. Went to see a patient for my practice physical. These are all volunteers and we don't get charts or anything, just a slip of paper with their name and chief complaint. I walk into the room and this older gentleman is holding his cup of coffee and didn't shake my hand, which threw me off guard. Then I noticed one of his hands was much weaker and kind of scrunched up, and he didn't move it. So I asked him about it and he was like, "Nah, it's fine." See, and proceeded to move it like a 1/2 inch. It clearly was not fine. I'm sweating now cause these are mainly just opportunities to talk with patients and they're supposed to be a breeze, but this guy looks like he had a stroke and had no idea. Turns out he was just messing with me, but I was ready to call in a real doctor cause I was freaking the frick out. Optician here. A few days ago a man called asking if he could see an optometrist ASAP. I told him we had no spots left and asked him what seemed to be the problem. He told me he felt he had an eye infection and it's been 4 days since he can't see properly from his left eye. Sometimes clients can complain from over-tearing or swollen eyelids, but no. He told me part of his field of vision was off for the past 4 days. We have indicators, such as flashes of light or dark spots, that tell us if we are dealing with an emergency worthy of being sent directly to the hospital for emergency intervention from the ophthalmology department, and this was clearly it. I told him he has to go to the emergency room now. He tells me he has a busy shift at work and is a supervisor. I told him again to go to the hospital ASAP and to take it seriously. He tells me that he can't because his day will be scrapped. I told him to stop putting work over health and that this needed to be dealt with now. He still argues with me and tells me that he doesn't feel like waiting in the emergency room for hours. In any case, if you have symptoms resembling a retinal detachment, you are seen almost immediately. I insist that he must go. He then tells me I'll go after my day's shift. I tell him to cut it out and go. He then asks me if it's an emergency and to tell him what he has. Given that I'm not allowed to give any diagnosis by the phone, I told him to hurry to the hospital. He told me he would, and I'm pretty sure he stuck to his plan of finishing the day. Retinal detachment can usually be treated if noticed quickly. Not a doctor, but I work in a big, busy hospital. We had a 20-ish-year-old obese woman come in complaining of severe abdominal pain. Before she was even examined, it became clear that she was about to give birth. Side note, my hospital does not have labor and delivery, that is at our other campus a couple of miles away. This woman proceeded to give birth to a full-term 8 pounds healthy boy in hour and denied that she was pregnant and denied that the baby was hers. The placenta was still in her umbilical cord, not cut. The doctor said it's a boy and she said that's not my baby MK. Needless to say, psych was called along with a team from the other hospital to take the baby over to their campus. I often wonder about that baby and hope he is doing okay. Hopefully the mom put him up for adoption and he ended up with some great parents. Maybe not so weird because the person was whacked out of their mind, but once had a patient who was clearly on drugs and vehemently denying it. I'm not a doc, but I'm a lab tech and draw blood in the ED regularly. While I was drawing their blood, the patient was screaming at me to stop letting the green men that were coming out of my arm touch them. Turns out, they were tripping balls, but underage and refused to tell us anything for fear of their parents finding out. Patients lie about the most mundane things. They will tell you they don't smoke cigarettes when you can smell it all over them. You can see a pack in their purse, and you physically saw them smoking outside before they came in for their appointment. That's not what annoys me though. What annoys me most is that patients will Google what they think is their diagnosis, admit they did, get their diagnosis right, then argue with you about the recommended treatment and deny having read that also. The classic example is bronchitis. Patients will Google it, read the Wikipedia article, then still come in and demand antibiotics. When you confront them with this, they will pretend they didn't know that they read that antibiotics do not work. They do this with almost any disease in which the treatment is conservative management, and yet they will still come in asking for treatment that has no evidence. If you're going to become an internet expert, don't do it 50% and deny you didn't read the part about treatment. I work in pharmacy and so many people come in bitching that their doctor didn't give them antibiotics for some that doesn't need antibiotics, and it drives me nuts. For once a doctor has done the right thing, because way too often they just give them to shut the patient up, and now they are getting bad-mouthed for actually doing their job. Needed to do a drug test on a patient who came in with his pregnant girlfriend. Guy goes into the bathroom. A few minutes later he comes back out with an empty cup. He goes back to his room to drink some water. Couple minutes later he hurries back over to the bathroom with a noticeable bulge in his pants pocket. He comes back out with an adequate sample. So, we run the test. It comes back negative. We then run a pregnancy test on the sample. That comes back positive. Dude denied his pregnant girlfriend provided the sample even after being told they can possibly have prostate cancer if his urine turns positive on a pregnancy test. It was unbelievable. I am a doctor. Not a single random thing up my butt is weird to me anymore. I've heard or seen it all. Nor is it that surprising when somebody is wacko enough to claim they got Lyme disease sexually from their husband, who got it vertically from his mother, and that's why they are sterile. If you aren't aware, this is bonkers. The actual weirdest thing for me was that one time when a severely obese person just refused to admit they ate anything but one small salad a day. It just comes down to math. You cannot get up to 500 pounds unless you put 500 pounds of stuff into you at a decent pace. Plus we found a snack wrapper in the inaccessible folds of your pants. Jeebus. I'm a medical coder and for some reason the word panis always makes me giggle. I don't know why, I just think it's one of the funniest sounding medical terms. Patient refusing to admit he is continuing to drink water despite being on fluid restriction for congestive heart failure. He would take a rag, soak up a bunch of water, put it on his forehead as if to cool down, and then squeeze the water out so it would run down his face and into his mouth. Doc, I just don't understand why my weight won't go down. This is water weight we were monitoring, not fat weight. In a heart failure patient, you try to find a weight at which her heart function is optimized, and then aim for this weight, which over the short term of a couple days, is largely reflective of the amount of fluid water in the patient. Very odd. We wondered if it was almost subconscious. Not a doctor but a nurse. I had a patient that kept giving herself chlamydia repeatedly from using her vibrator once she'd been initially infected with it from a random partner. We asked her about any other partners and toys etc. She denied until she couldn't anymore. I first got on this Reddit post 5 hours ago. Somehow I ended up down the Reddit hole reading about CM roaches, Jolly Rancher gonorrhea, squid masturbation, etc. God help me. A patient came in due to abdominal pain. Though we're thorough in our examinations, some parts are omitted for obvious reasons. One doesn't check teeth for abdominal pain, or check one's balls for a complaint of edema. Initial consideration was appendicitis. A few hours later, the patient's wife came up to me and whispered, "My husband is feeling a little timid to mention this, but he feels that one of his testes is a little bit sore." I went to take a look and his balls were swollen to the size of a grapefruit. Turns out the patient had an incarcerated hernia affecting his lymphatics leading to third spacing. That dude was taken straight to the OR. I'm not a doctor but I work in the hospital. We have a regular at here. She comes every single day. She figured out that we can't send her home before a doctor examines her if she complains of trouble breathing or chest pains. So she always does this. No ward wants her to come there and no doctor wants to be responsible. She's super manipulative, treats the nurses horribly and is very demanding. She is a opioid and benzo addict and usually wants more drugs and someone to take care of her like she's at the Hilton. Her goal every visit is to get admitted. She succeeded a few days ago when there was some issue, self-inflicted, with her colostomy bag. To avoid being sent home, she smeared crap in her IV trying to cause sepsis, just to stay at the ward. Had a 20-ish guy in the ED come in with excruciating chest pain, and looked very uncomfortable. Denied any kind of trauma. Turned out he had a fractured sternum. When I told him we figured out why he was having pain, he said, "Oh yeah, I forgot I overdosed yesterday and my friend gave me CPR." Patient came in with an irritated ostomy. Turned out to be an STI. She refused to admit she was using the hole for any sexual activity. This is the second one of these in the thread. Freaking nasty, I guess literally. That they can't afford their meds, yep, America. It's so weird, we can for sure tell you weren't taking them. It's put your life in serious danger, and if you don't fess up it could kick you off the transplant list for non-compliance. It's such a taboo, I guess, to say you're poor. You had to pick lights or meds, food or meds, gas or meds. It sounds so simple, doc, I just couldn't afford that and food, but it takes some work sometimes to get people to just tell us. It's amazing how many patients receive Narcan, but have never used opiates. Narcan only reverses opiates, no other class of medications. They come in with shallow, infrequent respirations, pinpoint pupils, and sometimes needles and H or pills in their pockets. We Narcan them. They wake up, then deny everything. Denial is also a heck of a drug. The drugs in their pockets are never theirs. Sometimes, they are not even their pants. They walked outside pantless, found a pair of pants in their size, never checked the pockets, ended up not using opiates, received Narcan, and those pants somehow happened to have H in them. Amazing. Also had someone walk in with a bullet in their butt, adamantly deny there was a bullet in their butt and they weren't shot. Not a doctor but work in a radiology clinic. People always lie about having fasted for their appointments. They'll come in for their abdominal ultrasound and say they haven't eaten. You are literally holding a bag of McDonald's, sir. We had a guy at the VA hospital in urology who complained of a white urethral discharge. Had many tests, we couldn't figure it out. Multiple visits later, he was admitted due to urinary obstruction. It turned out he was squeezing toothpaste into his urethra. Not a doctor but friend of a patient. I had found her in the bathroom after an attempted suicide. When I found her, she was drifting in and out of consciousness. En route to the hospital, I had called her parents letting them know about the situation, and to my disbelief, they wanted me to lie and say that she had forgotten that she had taken too many pills and that's why she was non-responsive. I refused to do so, but by the time I arrived at the hospital, they were already there and were the ones who gave an account to the Tridge about what had happened. In the air, I lied and said that I needed to use the restroom before flagging down her attending and telling him what had actually happened. Not that I had actually needed to do so, because the doctor wasn't an idiot and knew what had happened by just one look at my friend. A referral was made to a pediatrist, and by the time my friend was fully conscious again, she was sent to a psychiatric facility for monitoring and treatment. A suicide attempt is a suicide attempt. Why lie about it? Whilst I was working in general surgery, we had a 14-year-old kid come in with a small bowel obstruction. The x-ray showed this huge circular object in his bowel and we just couldn't work out what it could be, so he went in for open surgery to take it out. When we opened him up, we found a fully intact water balloon, filled up and tied. When he woke up, when we asked him why he ate it, he said he didn't remember eating a water balloon. No idea how you could forget it though. There's a few references to a recent bug eater. Can someone link that post? When I used to work in a Navia, we had a woman who came in complaining of abdominal pain. She'd only speak to the nurse, and I soon wheeled her over to radiology to get films of an obstruction. No one was given any information beyond that. I soon found out why. The rad tech took a couple of shots and we saw it. She lost a phallic shaped object up there. When partaking in anal play, use toys with either a bigger base than the toy or some other type of retrieval method. She tried a few shots, but couldn't get a really good image of it. Finally, after the third shot, the rad tech stomped into the room and said, "It's still on, isn't it?" It was 3 AM. The tech had worked all day and was woken up to take the films. Was it Ted's mom who said nothing good ever happens after 2 AM? The patient sat up as straight as she could, held her head high, and said, "I have no idea what you're talking about. How I finished that shift without passing out laughing, I'll never know." Not a doctor, but I work with people occasionally in a hospital for other reasons. Criminals. Anyhow, one day I was sent to pick up a woman for transport to a different facility, and she was being treated a host of different things. She has complained of a lot of pain in the area where her colostomy bag was attached. I believe it's called a stoma. Again, not a doctor. Long story short, she was diagnosed with a host of things wrong with the stoma, and the doctors were all guessing how the heck she had gotten some of those complications. She eventually admitted to me and the rest of the room that she was still engaging in her lifestyle of a prostitute, and men would pay extra money to make sweet love to the hole where her colostomy bag attached. TLDR. For enough money you can make love to the hole in the side of someone's abdomen. Just glove up so you don't give her an STD there. She was making some money on the side. I'll see myself out. I'm an RN, but I've had patients lie about not pooping because they are worried about a suppository. I make sure to go full worst case scenario about bowel obstructions, impaction, emergency surgery, etc. It normally makes them follow my directions, take doctor ordered bowel meds, order certain foods, drink fluid, walk if able, etc. and scares the crap out of them. Not my story, but a fellow co-worker's story. This 360-pound woman came in, well, wheeled in as she was in a wheelchair since walking was so difficult due to her weight, complaining of severe stomach pain and itching. They took her in and started examining and asking questions. As she's talking about the area that's in pain, they lift up a heavy roll of fat, and there were 2 Twinkies squished in there, all moldy and almost necrotic smelling. It was apparently there for nearly 2 months. Want to know what was inside those Twinkies? Maggots. Hundreds of them. All of her pain was caused by the maggots trying to burrow in her necrotic skin, left untreated. We believe she put the Twinkie there so they would eat the Twinkie and not her necrotic tissue. She denied that she left them there and has never eaten a Twinkie in her life. Kept going on and on about someone had stuffed them there while she was asleep. Apologies if this is not well written, I am quite tipsy and on mobile. With stories like that, I understand your use of alcohol as therapy. Not a doctor. Family member is a psychiatrist. Told me that patients won't ask for a new doctor psychiatrist even if they hate them. I mean, come on. This is about you. The doctors probably deal with worse crap a dozen times a day, and you asking for a switch isn't going to make their day that much worse. Maybe even better. Just tell the absolute truth. We caught a mother of a patient injecting poop in his son's veins. She obviously denied she could do so, because her and his son were well known in the hospital, so she gained the trust of the nurses. She was arrested and diagnosed with Munchausen syndrome by proxy. The poor baby is alive but with development problems. Volunteering as an RSO and medic during my local range club's open weekend. Dumbars rested the barrel of a 10-22 on the toe of his boot for a picture and shot himself in the foot. Claimed it was a sniper. I told him that the entry wound was straight through the top of his boot and asked him where shot came from. They must have a stealth chopper. We need to call the cops. You were inside when it happened. I saw you do it. Fellas, don't do bath salt. I had a patient who came in for a corneal abrasion from getting crack in his eye, was still holding the crack pipe, and claimed that he didn't smoke crack. Not a doctor, but work in a psych hospital. Walked into a patient's bathroom at 3 AM. BC. He was in there for a suspiciously long time. To find crap smeared literally everywhere, and he's standing there butt naked staring at me. He swears up and down he has no idea how it got there, and he was